So one of the ways we responded was actually quite quickly. We developed a position statement stating what are our principles and our beliefs and what we thought would be, because we're very concerned about the impact on COVID on cancer care, particularly diagnostics and screening and early detection and continuation of care, with the people perhaps being cut out of access to healthcare and healthcare being overwhelmed. We are also very concerned at one point with how nurses are being perceived globally. So while there was parts in the world that they're all, clapping for nurses and doing all these wonderful things, that was not a uniform response. And I think there were many parts of the world where nurses were feeling threatened or were feeling ostracized or not being valued for the efforts that they are putting in. And the third concern, I think, was with all the emphasis on COVID, there was a lot of nurses that normally will be in cancer care who are then, reassigned because that was the emergency. And our concern is that once the pandemic's over, that the oncology nursing workforce doesn't get diminished in terms of numbers, that these reallocations don't become permanent. So I think one of the things we did is that we're able to very quickly deploy a position statement on the role of cancer care during COVID and the role of nursing, oncology nursing at the times of COVID. And we'll see, right? I mean, we still to see what's going to happen next. In terms of some of the areas that ISNCC is focusing on, and of course, Julia Downing now is in charge of that committee, and she can answer better, but we are working on developing a policy statement on nursing leadership and policy, exactly to emphasize this role of nurses in this realm. And on a more specific area, there is a position statement on palliative care for children, pediatric palliative care. And we are right now in the process of revising some of our older position statements, including the one on tobacco control, which it's a little overdue for revision. And so we are in the process as we speak